Good morning. My name is Nurse Marita, and in this video, I'm going to talk and demonstrate how to perform tracheostomy care. When giving trachea, there are a couple things we need to check before starting. First, we need to check the provider's order, and then we need to check for in the patient chart. For the patient chart, we need to look for the patient norm, because we have to take the patient vital signs, and everybody have their norm. And then we also need to identify the patient, to make sure we have the right patient. And then we also need to make sure that there is an escalator or an extra inner cannula in the patient jaw, in case there's an emergency, like an accident. We drop the inner cannula on the floor. Then we need to make sure that there is one there before we start the procedure. We start giving care. Then we have to make sure we collect everything that we need, so we don't have to go back and forth into the patient room. And then we can start. Before starting, there's one more thing we need to check. We also need to check for the patient, assess for vital signs. We need to assess them for respiratory, O2 sat, and lung sounds. We also have to assess for pain before we start, because we don't want to start and then the patient is complaining of pain. So we need to know if we have to administer pain medication before performing the care. Then we can start. Once we collect all the stuff that we need, then we can start. Before entering the patient room, we have to knock. And then once we get in the patient room, we have to introduce ourselves, and then explain to the patient what we are about to do. We don't just go and start working on the patient without letting know what we're doing. And then once we do that, we start by we open our tray. We open our sterile tray. When opening our sterile tray, we have to open it away from us. We open it away from us. And then there's one thing that I missed. First, we wash our hand. After washing our hand, we put another glove. We put a glove, not a non-sterile glove. We raise the bed to our level, because we have to raise the bed to our level. And then we dispose of the glove, or we can also wash our hand again, and then we add the sterile glove. When putting, I don't have a sterile glove right now, but when we put it on the sterile glove, we have to make sure we pick it up from the cuff. We don't touch the outside. We touch the cuff, and then we put on the glove. We don't touch the outside. Then we put on the other one the same way. We start with the dominant hand, and then with the other hand we can always fix the other one, but we don't touch the outside, only the cuff or the inside of the glove. And then we can open the drip. We open the drip. We put it on the surface. Okay. We put the shiny one on the bottom, and then we throw everything. That we have in the tray inside in it. And then we have in the tray, we have 3 compartments. Each compartment is used for something. So in the first compartment, we will put water, sterile water. One part is for one, we put sterile water to rinse. In the other pot, we'll put 1 unit of peroxide and 2 units of sterile water to wash and soak. And the other pot, we can always use it to put the Q-tip, the brush. We have the pipe brush to try, and any extra stuff that we're gonna need. Okay, so I will also need the towel. I will need the towel to put on top of the patient chest. You know, not too dirty or wet the nightgown, to prevent from wetting the nightgown. And then we can start. We can start by hyperventilate the patient by 2.5 liters of oxygen, because we need to hyperventilate the patient before we start the procedure. Then we will remove the inner cannula. When we move in the inner cannula, we don't just go and pull. We have to, with one hand, we hold the faceplate, okay, and with the other hand, we will turn and slowly pull the inner cannula. Why? Because we want to prevent decannulation, because there's a slight chance when pulling the cannula, the inner cannula, we can also remove the cannula. We don't want that. And we also need to do it gently, because we don't know if there's any build-up secretion under the inner cannula. So, and if it is the case, we have to suction the patient also. Okay, so after I remove the inner cannula, I will put it to soak in my sterile and peroxide water. While the inner cannula is soaking, I will then proceed to clean the faceplate. The way I'll clean the faceplate is by using the Q-tip. And while doing that, I will do it up and down, up and down, up and down, up and down, up and down. Rinse and do the same thing, up and down, up and down, and then dry, pat dry. We don't pat dry. Okay, and then I will assess. I will also do the back. You know, we do the front and we do the back with the different Q-tip. We do the back and then rinse with a different Q-tip. Rinse and pat dry. And then I will change the filtration dressing. I will change it and put another one. Okay, and after doing that, I will also change before that, I will make sure I clean the hub. We clean the hub from top to bottom. Clean the hub from top to bottom. We don't go inside. We clean the outside of the hub, up and down, from up to the bottom, and dry also, pat dry. Okay, anything you do, you dry. You don't want to leave any moisture, to leave any, because when there's moist anything wet, there might be a buildup of bacteria or stuff like that. You don't want any of that in your patient, And then we will remove the Velcro stripe. When we move in the Velcro stripe, we remove the Velcro stripe one at a time, one side at a time. We don't do both sides. Okay, you don't want to also remove you don't want to cause no harm by removing the whole tray, the whole cannula. So you don't pull, you support one at a time, You remove one stripe, you clean, you assess the neck for any redness, any skin breakdown, and then you clean and dry with the towel. And then you put one side, then you go to the other side, you assess, you do the same thing, you clean and dry, then you put the other side. And when putting the Velcro stripe, we have to make sure that it's not too tight. How do we check if it's not too tight? We check by putting 2 fingers under the stripe. If 2 fingers cannot fit, it is too tight. We have to loosen up a little bit. And then we do that. After doing all this, now we proceed by cleaning the inner cannula. When cleaning the inner cannula, we start from the outer. Okay, we brush. Okay, we do the inside, brush, and then we rinse. Okay, then we dry, pat dry, and from to the outside, and we will use the pipe to dry on the inside. And we can also tap 3 times in the cellophane. We don't shake, no shaking. And then we put it back into place. When putting it back into place, we do the same thing. We hold the faceplate, and then we put it in. Make sure it goes to the same direction. This one is straight, but the real inner cannula will be, we have like a curve. So you make sure you put it in the same direction. Then you turn it and lock it by aligning both colors. Some are red, some are blue. Make sure both color are aligning together. And you should hear the little clip too also. And then after doing that, you can also ask the patient if she feel comfortable. Is there any discomfort? Is she comfortable? And then once we do that, we reassess. We reassess for O2 sat, lung sounds, and respiration. And then we put the oxygen back to the normal flow. If the patient was on oxygen already, we put it back to its normal flow. And then we lower our bed. Okay, we clean up, wash our hands, and then we document. When documenting, we have to make sure that we document that the patient react to the care. Did the patient feel good? Was everything effect and everything? And that we put time, date. If we did suction, and when suctioning, we also, if we had to suction, we will suction by circular motion, coming out, not going in. And if we did suction, we will put that too in the documentation, and we'll put the amount, the consistency, the color, and was there any order to the secretion. And we also have to check if it was inflate, if the trach was inflate or deflate. If it was, because sometimes some patient, it's mean the trach need to stay deflate. Sometimes it's patient is the provider's order. Sometimes it's not. If it's not, we need to check that out. If it was supposed to stay deflated, or was it, and all that. And then that's it. And that's I will be providing care to a trach patient, and this is it. Thank you.